I'm Dr. Paparao, consultant physician, Citizens Hospital, Nallagandla, Hyderabad.
My name is Krishna. My age 35. My question is, what are the signs and symptoms of malaria?
The commonest presentation of malaria depends upon the signs and symptoms of the patient. Initially, the patient comes with symptoms. The symptoms, most common symptom is fever with chills and rigors. So, fever can be initially continuous, thereafter it sets in a pattern either once in 48 hours or once in 72 hours. This is the most common symptom. Sometimes the symptom could be depending on the part affected, like shortness of breath if there is anemia, hemolysis. If there is some rare presentation is diarrhea, and sometimes pneumonia, what we call ARDS. These are all the varied and different presentations. Still most common is fever with chills and rigors. And the signs being, if you examine properly, there will be enlargement of the spleen and enlargement of the liver of the abdomen, and diagnosing is in the laboratory.
Hello, myself Neetu Siddham and I am 30 years old. I have a question. So I wanted to ask that does mosquitoes transmit HIV?
Most of the mosquitoes which causes disease take blood meal from the human beings. Some of these do carry the viruses which cause dengue fever, which cause Japanese bee encephalitis, as well as some other yellow fever and some other viral disorders. But there is no evidence that it causes or transmits HIV. But why it doesn't transmit? Because if it takes blood from the HIV patient, they do go into the abdomen of the mosquito and it takes along with the blood, but it takes about 1 to 2 days time for the mosquito to digest the blood. In this 1 to 2 days, because the environment is not congenial for the HIV virus, they get killed and vanishes, and thus the mosquitoes are not capable of transmitting HIV virus.
My name is Satish. My age is 45 years. My question is, what is the most common method of diagnosing malaria?
Thank you, Satish. The best way of diagnosing malaria is, one is by clinical symptoms and presentation of the patient. Number two, the laboratory investigations. Out of the laboratory investigations, you have what is called antigen test, which can be positive from day 2. And this is what is we routinely do is what is called parasite V and F. And this test is highly sensitive and specific also. And this is the best test still now. And second test is thick and thin smear for malarial parasite. An experienced microbiologist can easily pick up a malarial parasite or its stages, various stages of development of malarial parasite which is causing disease for the patient. So there are mainly two methods. One is antigen test, second is by direct smear examination under microscopy by an experienced microbiologist.